Good afternoon, everyone. I'm Dr. Kristen Obank, and welcome to the IVMA's COVID-19 webinar update for veterinarians. First, we would like to thank our sponsor, Iowa Wealth Management. We'll have a word from them here shortly.
So the Glazer family has been in the financial services industry for over 50 years. The story starts way back in 1967. My grandpa, Jim Glazer, decided to leave the meatpacking industry, pack up his 6 kids and his wife, and start over in the Des Moines area and become a stockbroker trainee. And a couple years later, then he recruited my grandma, June Glazer, to be in the industry as well. And she became one of the first ever licensed female financial advisors in the state of Iowa, which I'm really proud of. And then about 10 years later, John entered the industry in 1985, and then he moved to Des Moines. He started Iowa Wealth Management in 2010, and then sure enough in 2016, I decided to leave economic development and start working in financial services as well. Our family is really proud to have been in financial services for over 50 years consecutively and serving the Des Moines area well. So our wealth management process is a 3-step process. The first is comprehensive financial planning. The second is portfolio management, and then the third is tax and estate planning. Now, our process is based on prudent man theory. It's an old legal theory, and it's been around for centuries, and it focuses the emphasis on putting the responsibility with us, the advisor. Essentially, it's our duty to make sure we're investing your portfolio in quality investments that also have a cash flow initiative. It focused on cash flow and also having a conservative approach. So the example that we use with our clients is something that I think veterinarians understand very well. Your portfolio should perform like a well-run farm operation. So for example, your investments should perform and give you a good type of cash flow. So like your farm would provide you a good source of cash flow from the crops or your animals, and then you wouldn't have to necessarily sell the acres, which is your stocks. The hope is not to buy low and sell high. It's really actually to buy your investments and live off the cash flow, and then hopefully never sell those acres of yours so that you can eventually pass that on from generation to generation.
Iowa Wealth Management is experienced in developing prudent financial plans to meet your retirement needs. Plans that focus upon the cash flow needs of your retirement, unique to your situation. We know the questions to ask. We know that where to find the answers. We'd be pleased if you would call us and request a retirement plan meeting. It's a 3-meeting process. We'll meet with you, we'll ascertain your needs, we'll deliver the financial plan to you. You're free to use that with your current advisor, and if you wish, you can always retain us, which would please us greatly. We appreciate that you made us part of your new viral conference. We appreciate the opportunity to be of service to your noble profession. If we can ever be of any service to you, please do call us. That would please us greatly. Thank you, and have a safe conference.
I'd like to welcome and introduce Dr. Ann Garvey, who serves as the Deputy State Epidemiologist and Public Health Veterinarian for the Iowa Department of Public Health.
So I appreciate the opportunity to connect with you all through this webinar today. I know that on the previous announcements for today's event, it said Dr. Caitlin Pedati would be presenting this little bit of an overview. I'm going to stand in for her today and discuss kind of some background on COVID-19 and hopefully share some helpful resources with you. My name is Ann Garvey. I'm the State Public Health Veterinarian, and I also serve as Dr. Pedati's Deputy State Epidemiologist, and I oversee the infectious disease group here at the department. So we've obviously been really engaged in the COVID response over the last many months. And so I just want to share some background with you all and hopefully answer some questions that you're getting from both clients and probably from your staff. So I'll dive into our presentation today. I want to start the discussion just talking about the virus in animals. And as we all know, this virus likely originated in bats. The first reported infections were linked to a live animal market. However, this virus is spreading person to person across the world right now. It really has become a person-to-person virus. There's no evidence that animals are playing any kind of a significant role in spreading the virus. There have been a few identifications of animal infections with the COVID-19 virus. A small number of pet cats and dogs in several different countries, including here in the US, have been identified as being infected, and most of those pets had known contact with sick people. There were also some lions and tigers at the New York Zoo that tested positive after they showed respiratory illness. Those animals did recover, and they were known to be exposed to an infected zoo employee. And we've had mink on multiple farms in other countries and here in the US that have been infected with this virus. But again, what I really want to emphasize is that there's no evidence that animals are playing any kind of a significant role in spreading this virus. What we've found is really animal infections after subsequent exposure to infected humans. As we know, there's ongoing research with this virus and with animals. Some of the research is found some interesting things. Ferrets, cats, and some types of hamsters have been experimentally infected with the virus. They've been able to spread the infection to other animals of the same species, again, in a controlled laboratory setting. In addition, some non-human primates, so macaques, and common marmosets have been infected and become sick in a laboratory setting. An interesting finding and a good finding is that mice, pigs, chickens, and ducks don't seem to be infected, and they don't seem to spread the infection based on some laboratory findings, so that's good news. There is one study that suggests that dogs can get infected, but they may not spread it as easy compared to cats and ferrets. So again, that's just based on one study. All of this research is based on a small number of animals. As time goes on, I think we're going to find out a lot more about this virus. But again, the take home here is that animals have not been shown to be contributing to the spread of this virus in any significant way at all. I do want to touch on testing for COVID-19 infection in animals. Again, the routine testing of animals is not recommended, and we are really encouraging veterinarians to rule out the more common causes of illness before considering COVID-19. The Department of Agriculture and Land Stewardship does consider this to be a foreign animal disease investigation, so that's how they're working these up. We've worked jointly to identify a number of factors that we would consider as part of a case-by-case determination of whether we would recommend testing in certain situations. And those factors that we'll talk through with any veterinarian who's got concerns about a specific case. The first thing we want to know is there an epidemiological link to a positive human? So a COVID-19 infected human, that's an important point. We'll want to know whether that has occurred. We'll also talk about whether the animal is showing any clinical signs that could be compatible with COVID-19 infection in that species. We'll also talk about what we know about COVID-19 infection in that species and whether current research has indicated that animals of this species could be infected with the virus. And then we'll want to make sure that the more likely causes of illness have been ruled out before we would move forward with any animal testing. So again, routine testing, not recommended. We're really encouraging veterinarians to rule out those more common causes of illness. If there is some higher risk situation, we'd welcome the opportunity to talk to you, so you can call Dr. Kaizen at the Department of Agriculture and Land Stewardship or myself, and we are happy to talk through situations. But again, in general, we're not recommending routine testing of animals. So I want to kind of transition here and talk about human illness, because again, that's what's driving all this human to human spread. So symptoms in humans are listed here on the slide. I'm sure you're all well aware: fever, cough, shortness of breath, fatigue, body aches, headaches. One of the kind of unique factors that has been associated with COVID-19 infection is this sudden onset of loss of taste and smell. So that's been something that is really, as time has moved on, been more associated with this type of viral infection. And so it's commonly reported. Sore throat, congestion, nausea, vomiting, diarrhea have also been reported. But again, the big symptoms that really stick out are the fever and the chills, the respiratory issues, the fatigue and body ache, and then this loss of taste and smell. So as we move into the influenza season, we're pretty concerned that it's going to be hard to differentiate. We want to make sure that we're doing everything we can to protect people from infection. And so we're really pushing the influenza vaccine. So please, vaccine is out there. Please consider getting yourself, getting your family members, recommending it for your staff, that everybody gets their annual influenza vaccination. Because again, as we move into the flu season, a lot of these symptoms mimic each other, and also they'll both be circulating. So it's important to protect ourselves as much as we can. We often get the question about when should we seek medical care or health care? And we always recommend anytime you have concerns about your health, reach out to your healthcare provider. That's something that you should just routinely do when you have health concerns. But specifically, especially if you've been exposed or infected with COVID-19, anytime you have trouble breathing, if you're feeling chest pain or pressure, if you're confused, if you or your family members have trouble staying awake, or obviously if you're seeing some signs like blue lips or discoloration in the face, any of those symptoms are times in which you need to immediately seek health care. I want to take a few minutes and talk about the incubation period and the infectious period. As veterinarians, I know you're all very familiar with these terms. It does cause a little bit of confusion, I think, for other individuals in the public. And I'll talk through this in this slide, and then I want to relate them to the quarantine and isolation recommendations in the future slides. So the incubation period, the time from when someone's exposed to the virus to when they develop illness, could be as short as 2 days or as long as 14 days. The infectious period, so the time in which someone can spread infection to others, symptomatic persons, is considered to be 2 days before their symptoms started until 10 days after their symptoms started. They also need to be fever-free and have other symptom improvement for at least 24 hours. So for most people, by day 10, they're going to have recovered from their illness and will have been fever-free, and their other symptoms will have improved for at least 24 hours. But there may be some individuals that have a more severe illness, a longer illness. And so again, we would consider them infectious until they've been fever-free with other symptom improvement for at least 24 hours. Now, we do have people who don't have symptoms, but who tested positive for COVID-19 infection. We know that some people do not have severe symptoms. They may not have symptoms. And so for those individuals, we consider them to be infectious, so able to spread the virus to others from 2 days before they were tested until 10 days after they were tested. Part of what we do on the public health side, anytime a person tests positive for COVID-19 infection, we do a case investigation. And during that investigation, we'll ask a lot of questions about the person's illness, where they could have been exposed, and then we'll ask who they've been around during their infectious period. And we consider these people to be close contacts, and then we'll contact those individuals and recommend that they quarantine. So the definition that we use to identify the people who have been in contact with the case is anyone who's been within 6 feet of the COVID-infected person during that person's infectious period for at least 15 consecutive minutes. And when we're talking about community exposures, this is irrespective of whether the case or the contact is wearing a face covering. So even if you're wearing a mask, we would still consider you to be a close contact if you meet this definition of 6 feet for at least 15 consecutive minutes. Again, it's important to note that that has to be during the case's infectious period, which I just talked through on the last slide. I want to take a few minutes to talk through our isolation and quarantine recommendations. So our isolation recommendations for infected persons, again, we isolate infected people, we quarantine exposed people. So the isolation recommendations are based upon the infectious period, because we want to make sure that that person is not spreading illness to others while they're infectious. So we isolate those people until 10 days after their symptoms start. Again, as we talked about on the previous slide, they need to be fever-free with other symptom improvement for at least 24 hours. So this is for persons who are infected with COVID-19 and are having symptoms. If someone didn't have symptoms but tested positive for COVID-19, we would isolate them until 10 days after their test date. So for quarantine, again, we quarantine exposed people. That's based upon the incubation period, because we want to make sure that that person's not going to come down with illness after their exposure, and make sure that they're not in a position to spread that to others during that incubation period. So again, the incubation period can be as short as 2 days or as long as 14 days. And so we quarantine exposed persons for 14 days after their last exposure to the infectious person. And I know that the Iowa Veterinary Medical Association has gotten some questions about critical infrastructure guidance. And critical infrastructure guidance from CDC, I've included the link on this slide. This would be relevant to all of the different sectors listed here, including food and agriculture. So persons working in the food and agriculture industry could be considered critical infrastructure. I'd advise that you take a look at this guidance. If this is something that you're considering, it does basically allow for people who have been exposed to continue working with prevention measures in place. But if that individual becomes sick at any point, they should be immediately sent home. Surfaces should be cleaned and disinfected. And then we will contact trace, because again, that person would have been infectious for 2 days prior to symptom onset. So we would contact trace anyone that person had been around. So if the decision is made that there's staff that are critical infrastructure, they've been exposed to COVID-19 and they're going to continue to work, it's important that they're screened for symptoms at the beginning and end of each shift. There should be regular monitoring in place anyway. They should always be wearing a mask at all times when they're in the workplace, and they should be social distanced from other individuals. And again, it's really important to social distance, because this person's exposed, their likelihood of coming down with illness is much higher than anyone else in the facility. And the last thing you want to happen is allow someone to come in and work during that potential incubation period and have them then potentially re-expose more of your staff. And so it's important to make sure you're social distancing with any individuals that might fall into this category. And again, they should be wearing a mask, cleaning and disinfection should be in place, and there should be symptom monitoring at the beginning and end of each shift. So again, that's a decision that employers can make if they feel that the individuals fall into one of those categories of working in the food and agriculture industries. If you have questions about what the current activity is in Iowa or in your county or in your area of the state, I would really encourage you to take a look at our website. We have a lot of different data sets that are available, and they're interactive, and so you can really drill down to your county level. We have data about specific cases. We have epi curves that would show how cases are increasing or decreasing in certain areas. We have breakdowns by age and whether there's symptoms and sex, and there's a lot of different information that's readily available on our webpage, and I included the link here on this slide. And again, I'd really encourage you to take a look there. It gives you a sense of kind of what's going on in your area of the state. Now, you can drill down to your county. So for example, I just included a couple of screenshots of the data that is available, and this was as of yesterday. We have over 83,000 infected Iowans, and over 750,000 Iowans have been tested for COVID-19 throughout the response, for a positivity rate of about 11%. And this is statewide numbers. This was one thing I would want to be clear on is that this is live data. So as new cases are reported, they get incorporated into these numbers throughout the day. And so this is the things I have on the slide here, just a snapshot in time based on when I pulled these screenshots yesterday. So it's always in constant kind of real time. So you'll see things being updated throughout the day. There are two resources that I think are very important to kind of point out to you all. Hopefully you're aware of them. The first one is Interim Infection Prevention Guidance for Veterinary Clinics. This was put together by the Centers for Disease Control and Prevention. I think it's a good document. I've included the links here of things that you can consider in your practice. So again, I just want to make everyone aware of that resource. The other thing, CDC has a lot of communication resources on their webpage. And so there's posters of all kinds. I just included one example here. The link takes you to communication resources. And I encourage you to take a look there if you want, if you're looking for posters to just hang in the clinic or to put in certain areas of the clinic. Most likely it's already been developed. So just take a look there if you're looking for things to share with your employees. So again, I appreciate the opportunity to speak to you all today. Dr. Padati will be answering questions as part of the live Q&A, but I appreciate the opportunity to present this information to you. Appreciate everything you're all doing to keep your families safe, yourselves safe and healthy, and your staff. Certainly, if you have questions or concerns, don't hesitate to reach out to the department. We're here to support everyone, all of you. And again, just appreciate everything you're doing through the course of this really unprecedented pandemic response.
Hi, I'm Dr. Kristen Obank. I normally serve as a veterinary specialist with the Center for Food Security and Public Health at Iowa State University's College of Veterinary Medicine. Earlier this spring, during the Iowa State COVID-19 response, I was asked to play a role on our testing task force and public health team. I'll talk a little bit more about the functions of those groups here in just a bit. And then in mid-July, I was asked to come on board as the Iowa State University COVID-19 Public Health Coordinator. In this role, which I assumed on July 13th, I lead the implementation of our comprehensive public health strategy for Iowa State's COVID-19 response, and work very closely with our partners across campus to ensure that that strategy is being carried out as things change, which they do very quickly during the COVID-19 pandemic. So today I'm just going to talk through with you just a few things about what Iowa State is doing for our COVID-19 response. As I mentioned, we have a structure set up at Iowa State. We're under an incident command system structure, so we have a unified command as well as a public health team that functions within that unified command. So our Emergency Operations Center has been activated for over 230 days now. We continue to be activated and continue to modify our structure as needed. The public health team themselves that functions within that structure is made up of partners from across campus. So we have a 105-page public health plan that our team came together and developed this past summer. And that plan covers everything from our testing strategy to our communication strategy contact tracing and case investigation, as well as vaccine planning for when that COVID-19 vaccine is available and how we'll distribute that across our campus. Testing at Iowa State, we are very lucky to be able to partner with the Veterinary Diagnostic Lab on Iowa State's campus out at the Veterinary College. This has been a huge success for us. They have been certified and work closely with the State Hygienic Laboratory in Iowa. And because of that, we are able to do PCR nasal swab testing through the diagnostic lab and offer those services to students, faculty, and staff. And we were able to do that as well as many of you probably heard about our move-in testing that we conducted when our students moved onto campus in August. Those test results are able to be turned around very quickly, typically within a 24-hour time period because of that partnership with the diagnostic lab. So I want to thank them for their ongoing collaboration. So currently, we are offering testing to symptomatic individuals, so people who are showing symptoms of COVID-19, and then also individuals who've been potentially exposed to a positive case. And that testing is available for faculty, students, and staff on campus. Our move-in testing that I mentioned earlier, we did require all students who were moving on campus, either into residence halls or on-campus apartments, to be tested through PCR testing done at the diagnostic lab. That was over 8,000 students we tested in a 2-week time period, and that was in August. We spread that out over the course of 2 weeks so that students would be delayed in moving in, particularly if they had a roommate moving in with them and could have their test results back. Anyone who tested positive was moved into isolation housing on campus or also had the option to go home to do their isolation. And then anyone determined to be a close contact of a positive case through our case investigation process had quarantine housing they could be moved into on campus, or they also had the option to go home. To touch further on our case investigation and contact tracing efforts, we've been helping to support Story County Public Health by doing the all case investigation and contact tracing for ISU-associated faculty, staff, and students. So we have a large group of case investigators on campus as part of our public health team that interviews each positive case, offers them the resources that they need, also ensures that they're taking all precautions necessary to prevent further spread of COVID-19. And then as part of that case investigation process, they do go through with that case who their potential close contacts may be. So anyone who may potentially have been exposed to them during their infectious period. Once those close contacts are identified, our contact tracing team, if they're associated with Iowa State, follows up with them and in similar fashion, makes sure to give them all the resources and guidance that they need to prevent further spread of COVID-19. They're also sent a symptom tracker each day to monitor for symptoms of COVID-19 if they should develop those during their quarantine period. We've been able to increase the capacity of our contact tracing and case investigation teams, and so we're able to do that, follow up with those people quickly, with the main goal of protecting our campus by trying to identify cases and their close contacts quickly and keep those contacts out of the general population to prevent further spread and make sure that our close contacts are quarantining as well. And finally, I wanted to touch on one of our big success points throughout the COVID-19 pandemic has been our ability to partner with not only our community partners within our Iowa State campus, but also our community partners throughout the city of Ames and Story County. And together, our communications team and those community partners developed something called the Cyclones Care Campaign. And the Cyclones Care Campaign focuses on 4 healthy behaviors that we're encouraging everyone to follow. Those include wearing a face covering, physical distancing of 6 feet, washing your hands frequently or sanitizing if water is not available, and then staying home if you're sick. And through these 4 healthy behaviors, we're able to prevent the spread of COVID-19 not only on our campus, but throughout our community. And so these signs, as you can see here, are posted around campus, both in and outside of our buildings. They're also posted throughout Ames. The city of Ames adopted this campaign as well, so similar colors, similar messaging, so this can be seen frequently, and we continue to promote these healthy behaviors to help protect the health of our campus and our community. Overall, this has been a great experience. My veterinary education and my public health education prepared me very well for this role, and I've had the pleasure of working with a wide variety of people across campus with expertise in many different areas. And so we continue to tackle the challenge of COVID-19 for our campus community and helping to keep everybody safe. Thank you. Next, we'd like to welcome Dr. Lisa Tilges from the Prairie View Animal Hospital.
Thank you, IVMA, for offering me to speak today on my experiences with COVID-19 in our practice, and hopefully by sharing my experiences, I'm able to help most of you that are in the trenches like I am. My name is Lisa Tilges, and I'm owner of Prairie View Animal Hospital, and we are a small animal hospital located in Grimes. And so pretty early on, starting March 17th, we decided to close our building to all visitors and all clients and focus on curbside care only. At that time, we also started to write our COVID-19 processes. So it gave us an overview of what we thought our curbside care would look like, as well as outlining our disinfection procedures, our dilutions, our communications, and things like that. At that point, we also decided to take our potential COVID-19 exposures on a case-by-case basis. So for instance, we had an employee whose husband was exposed at work. And so our employee stayed home for 14 days to self-monitor for symptoms. And at that point, we weren't necessarily requiring masks for everybody that was in the hospital, but we had enough of these potential COVID-19 exposures that we decided to make masks mandatory, and we still are today. So our COVID-19 exposure happened mid-July. So if you think about it, that's 3 months of nobody but our employees being in the hospital. But we had some major computer problems, so we had to have our IT technician come in and work pretty much full time for a good part of the week. And he was present at our clinic that entire time. And then come Friday, July 17th, he was there in the morning, but he started showing symptoms in the afternoon, just really mild symptoms. So he went ahead and got tested, and sure enough, 4 days later, we got a phone call from our IT account manager saying that one of their employees that was in our hospital did test positive for COVID-19. So what did we do? We were notified late morning, so we decided to close just for the rest of that day on that Tuesday to allow us to come up with an action plan and to, again, clean the hospital. If you think about it, this is 4 days later after our last exposure to him, and so we were already doing our cleaning procedures based on our written COVID-19 processes. And so we contacted the Iowa Department of Public Health, and based on their guidance, we came up with this plan. So anyone who was within 6 feet or closer or within 15 minutes or more and not wearing a mask, we were required to get tested. And luckily enough, or maybe unluckily, the only person in the hospital that had to be tested was me. Of course, he was throughout the hospital working on all the computers, for short periods of time. But there was me in the office with him, making phone calls, doing office work, eating my lunch with my mask off, talking to him. And so I was the only one that met that criteria, and luckily enough, my test was negative. Any employee who felt like they had to be tested, we encouraged them to do so. But anybody who had to be tested or elected to be tested had to self-isolate at home. So they couldn't come to work until their test was negative. And we had one employee who decided to take a couple days off to get tested. We communicated everything related to this COVID-19 exposure and any process changes to our employees verbally. And I kind of make that point because clearly it's important to have clear communication with your employees, but then this also prompted us to change our COVID-19 processes as far as how we communicate with our employees. So what did we learn from this? What did we change? Our COVID-19 written processes that we have in the hospital are constantly being reviewed. They're constantly being changed based on the changes and the recommendations. But 2 specific things that we added to our COVID-19 processes is we have a written process now for employees that have been exposed to COVID-19, in particular outside of work. And then we also have a written process now for employees that have a confirmed case of COVID-19 and written down now, so we don't have to scramble at the last minute and we kind of relearn everything. We also changed the way that we communicate COVID-19 with our employees, and now they're communicated via email as well as verbally, and that way we have that electronic trail to really rely on when we need it. We also realized how important social distancing was. We are in a small bubble of about 11 people, and we realized that even within that small bubble, that social distancing is important for our health and for the business. So we encourage further social distancing, particularly in the break room and at workspaces, and whatever is feasible, of course, within a veterinary setting. And I learned that I constantly have to try to keep up with all these requirements, all these guidelines, all these employer responsibilities, that even as I get busy within our practice, we have to keep up with these so we're not scrambling last minute and we're doing our best to keep everybody safe. And I wanted to take a minute to also talk about our experiences with the Families First Coronavirus Response Act. The employee that was out for a couple days to get tested, she did elect to just take PTO, but there was another situation in which our employee's daycare was closed for a few days due to a potential exposure to COVID-19. And so according to this website, step one is to figure out if they have a qualifying reason to get paid through the FFCRA. And based on this, we determined that she qualified for reason number 5. And that's important to know what reason they qualify for, because the following steps that you take are based on what qualifying reason they have. So step 2 is determine what duration of leave they qualify for. And so based on reason number 5, our employee did qualify for up to 12 weeks. Now, she only received 3 days of pay, but she could have up to 12 weeks depending on the situation. Step 3, again, based on reason 5, we had to calculate her rate of pay. And so based on reason 5, we were required to pay her 2/3 of her regular rate. And it's important that your employee provides proper documentation. So in this situation, the employee's name and the reason they couldn't work, what the daycare's name was, the child's name, and that's all listed as well within that website. And the employer does receive dollar for dollar tax credit for the wages that you pay under the FFCRA. So I encourage all of you that can take advantage of that tax credit to go ahead and do so. So that's our last 6 months. It's been crazy. It's been stressful. Luckily, we've all been healthy and safe, and hopefully with the written processes that we have in place, we continue to be so. Thank you.
Then we'd like to welcome Dr. Ashley Williams from Creature Comforts Veterinary Hospital.
Hi, I'm Dr. Ashley Williams with Creature Comforts Veterinary Hospital, and I'm just going to talk a little bit about how we have been dealing with COVID-19 in our clinic. So starting in March, we fairly early started to think about going to curbside only. On Monday, March 16th, our doctors started putting together protocols for our clinic, for our staff, and also for client safety. So we sent out email and social media announcements that we were going to be going to exclusively curbside appointments. We wrote up dialogue for our receptionists to be able to communicate with clients as well, made door signs for our clients so that they knew what to expect when they got to the clinic. So our protocol for curbside was, and it still is, that clients call when they get there, we take history over the phone, and then we go out and bring the patient into the hospital for our treatments. We're using online jot forms so that we can do paperless signatures for our estimates and treatment plans and things like that. And then we've been obtaining payment either over the phone, or more recently we have been bringing credit cards into the clinic so that we can run those to free up phone lines. We also did modify our staff schedule. We had a couple of doctors that needed to be on long-term leave due to being immunocompromised themselves or having family members that were immunocompromised. So we reduced down to 2 doctors per day rather than 3. We also, kind of end of March, we split into a team-based approach. We are a hospital that's open 7 days a week, and so we were able to split into a Monday, Wednesday, Friday crew, and then a Tuesday, Thursday, Saturday, Sunday crew. This also allowed our working parents to be able to be working on the weekends, but be home during the week with their kids to do virtual school at home. We increased sanitation efforts in our clinic, obviously, and then we did require masks to be worn at all times, and we're still continuing to do so. We postponed all elective procedures and all of our dental procedures at the time to conserve PPE. And we also offered telemedicine appointments. We did virtual appointments over Zoom. Our doctors that were at home were able to facilitate those appointments. That really only lasted a few weeks. Unfortunately, we didn't have a lot of clients that were interested in that. Most people still wanted to come to the clinic, so we just did that for a few weeks. Once PPE was able to be obtained, we started working through our backlog of procedures and dental procedures. And then in June, we started blending our teams back together. The clinic was just very, very busy, and it was really difficult to keep the teams completely separate when we were starting to see staff exposures to COVID-19 and needing to isolate at home. We were also offering some in-clinic exams for our clients that really requested that. However, since case numbers in Iowa have continued to rise, we've since gone back to exclusively curbside. We have a fairly large staff. There's 37 of us. So we've dealt with quite a few exposures to known positives. And so we have kind of dealt with that on a case-by-case basis. We have written protocols in place that determine how long people need to stay home and when testing is required prior to coming back to work. We've had also our fair share of some symptomatic employees where symptoms are pretty vague. So far, everybody has come up negative, so we haven't dealt with a positive employee yet at this time. So I got an up close and personal situation with COVID. I was working on a Saturday and my husband called me at work, which he never does. So I knew something was up and he didn't feel good. So he just had fatigue, a low grade fever, it was 99, and muscle aches. So he just really didn't feel good. He did call his doctor and his doctor said that he should be tested. But of course on the weekends there's no testing capabilities. So we had to wait until Monday. I found coverage for myself at work and we just stayed home. He was tested on Monday. On Tuesday, he got the call that he was positive, and so then of course I needed to be tested. I went in and was tested. I got my test results on Wednesday and I was negative. Our girls are 5 and my youngest was 10 months at the time. We all quarantined at home for 14 days. Chris was pretty sick. He dealt with a lot of fatigue, muscle aches. He had tingling in his skin that he reported, shortness of breath. His chest just felt heavy, but he never got sick enough to have to go to the hospital or anything like that. So we quarantined at home as a family until July 3rd. Chris was isolated into either our bedroom or the basement. We wore masks anytime we were all in contact in the same room. And pretty much the girls and I just hung out for a couple weeks. They remained symptom-free and so did I. I was able to get a second COVID test prior to going back to work. So I stayed out of work for 2 weeks and got tested on July 6th, which was also negative, and then I was able to go back to work. He dealt with symptoms of fatigue and shortness of breath for about 30 days, and now seems to be completely back to normal. So dealing with the global pandemic with the novel virus has definitely been extremely challenging in both my personal and also with the veterinary industry. We're fortunate that our clinic has been able to remain open, and as an industry we've been able to provide care, but balancing staff and client safety while being super, super busy, as I'm sure all of you have been, has presented unique challenges. I look forward to eventually going back to our new normal, whatever that may be. Thank you.
We're now going to move to our live Q&A session. If you have a question, please use the chat feature on this channel to type that in, and we'll get an answer for you shortly.